Welcome back to your Pelvic Health Podcast. This is Susan Winograd, and I am thrilled to be your host. I am the owner and founder of Pelvicore Rehab, and we are going to talk about a really important topic today. It's probably overdue and a topic that we should have talked about a while ago, but it's never too late. We have an amazing team member of Pelvicore Rehab in-house today, our nutritionist and dietitian, Megan Perez. Megan, welcome to your Pelvic Health Podcast.
Hi, Susan. Thank you so much. I'm excited to be here.
Yeah, it's like so nice having like a Pelvicore Rehab team member doing the podcast with me today. We have to do that more often.
Yes.
So Megan, we've talked about this a lot. Actually, before we dive in, and I just dove in a little too early because I'm super excited about this topic, I really would love if you could just tell our listeners a little bit about yourself, because your journey to arriving sort of and landing at Pelvicore Rehab was really stars aligning. But tell us a little bit about how you became interested in your journey to treating, pelvic health related issues like PCOS and hypothalamic dysmenorrhea and all of those things. Tell us a little bit about yourself.
Yeah, absolutely. So I guess my journey started around, 2013 was officially when I became a registered dietitian. Prior to that, I had to go through many years of schooling. So I did my undergraduate degree in nutrition. I went on to get my master's degree in dietetics and nutrition. And from there, completed my internship, passed my national exam, and started working in the clinical settings. So I worked in a few different areas, long-term care, dialysis centers, hospitals, seeing lots and lots of patients, and eventually started my own practice where I was seeing one-on-one clients and also working in some eating disorder centers, substance abuse centers. Basically, I've done it all.
I think we all go through that journey. I think I've worked in, I want to say every field of PT until I found pelvic health. But I think it's important that we do that, right? Because it really gives us the time to sort of find our lane, right? To sort of realize what our passion and our mission is.
Yes, I totally agree. I think that's a huge part of it. Also, just gaining that experience working with so many different people, all of their different stories, everyone coming with different concerns, and just, learning how to work with different people, whether that be coworkers, whether that be patients, clients. So, I'm very grateful for all of my experiences. And as I was going through this journey, I started picking up, bits and pieces here of what I really loved and what was so interesting to me. And I'm sure this happened with you. Once you started seeing the kind of clients that you were meant to see, it just became easier.
Yeah, easier. And also I found, and I'm sure this is with you also because I know you and we talk all the time about certain clients, you have this hunger for knowledge. Mm-hmm. When you're finally seeing the kind of clients that you're meant to see and that you're passionate about, you all of a sudden develop this hunger for knowledge and you start learning almost like ravenously so that you can, do the best that you can for your clients. And I totally see that in you as well.
Yes, this is something we've talked about, and you and I are similar in that we will just dive into courses. Yes. If it sounds interesting, if it can help our clients, we're in.
Yes, 100%. And I think that is a sort of like a necessity because, I don't know if it's a necessity or really an indication that you're living your life's purpose. Because when you're just sort of going through the motions, and everything is like sort of rote, then I'm not sure that you could really say that you're, leading your mission. But when you really are hungry for knowledge and you want to take those courses and you want to do everything you can to not leave any stone unturned, then you know you're on the right path. You're on your life's path, right?
Yeah, absolutely.
So tell us, like, when you started to see your ideal client, what did that feel like? How did that evolve into really specializing in your niche?
Yeah. So I started working with clients who wanted to really leave dieting behind and find a way of eating that was peaceful, not stressful. And with this came a lot of clients with hormonal concerns. So I started seeing clients who were missing their periods, having period problems, being diagnosed with PCOS, endometriosis, and then also a lot of digestion clients, because typically stress worsens digestion.
Yes.
So there was this almost trifecta of hormones and digestion and just wanting freedom from stress around food. And it just all really clicked for me then. Like, oh my gosh, everyone who's coming to me is really dealing with at least a little bit of all three of these. And there's totally a connection here. There is a way to help these people.
Absolutely.
And most of them feel like a dietitian would just be talking about the nutrition piece. And then maybe they would need to see someone else for the stress piece and someone else for, the pain or the symptoms or this or that. And I felt like there was a way to be a support in a lot of these different areas. And in fact, it's probably better for the client when someone can see the big picture.
I totally agree. And I think that's part of the reason that I really was so excited to have you on board, is because I was finding that nutritional piece. And when I say the nutritional piece, I'm not talking about a diet. I'm talking about people's relationship with food, figuring out what works best for them and what doesn't. And for me, learning, knowing what I know now, I thought it was so fascinating that when people are in stress mode, when they're in fight, flight, freeze, when they are, we call it sympathetically upregulated, or in simple terms, they're wound up, physiologically, their body is going to do many things, but two big things which we share in helping clients is their sex hormones are shut off, because if you are constantly running after that imaginary saber-toothed lion, which is tiger, which is not so imaginary anymore. It might be social media, or it might be work, or it might be, our family. You don't want to think about getting it on with someone, right? So our sex hormones are shut off, and your digestion is pretty much going to end up being shut down, because when you're running after a lion or a tiger, you don't want to have to worry about pooping. So I think that's like, when I explain it to that to people, there's like this huge aha moment of like, oh, wow, that totally makes sense. And I realize I need help with that.
Yes. I've had many of these same conversations with clients. And another aspect is fertility, right? Fertility shuts down. Your body doesn't feel safe enough to get pregnant.
Yes.
And I'll talk to clients and I'll ask them like, oh, how are your stress levels? And they'll just be like, fine, I'm not stressed. And I see it in them. I see their shoulders up to their ears. I see their really shallow breaths. I see them looking at their phone, going from this to that, like not taking a moment to even breathe.
Yeah.
And I'm like, oh, no, you've just gotten used to this. This is your normal now.
That's their default, right? We get so used to feeling stressed, or if for a lot of people, they get used to feeling uncomfortable. They don't even know what it's like to not have period pain or digestive pain, right? They're always in a state of bloating and distension, and there is help for them, right? One thing I want to shed light on, Megan, which I think is fascinating, and it's been a learning journey for me working with you, is I remember when we first met, we were talking about things that you work with clients on and things that I work with clients on. And you said, well, I really enjoy working with disordered eating. And I said, well, that's not really our demographic. That's not what we treat. We really, treat, much more physiologically by, bowel, bladder, and sexual dysfunction. And then as we started to work together, I started realizing that the majority of our clients had disordered eating. It was like almost like a language that I had to sort of open up in my mind to realize, of course my clients have disordered eating, because so many times they have a fear of food. So if someone, just a couple of examples, if someone's leaking, they will think that maybe they have to, cut back on hydration, which is the exact opposite of what you would want to do. They become fearful of hydrating. Or if someone has digestive issues, they, pick and choose certain foods that they think are good for them, and they become fearful of other foods, right? So in your experience, like, how has that been working with Pelvicore Rehab and realizing that really you are working with most of our clients who have disordered eating and pelvic health issues?
Yes. Oh, this is great. So I'll start off by saying I am not surprised these clients have disordered eating for a number of reasons, but number one is just living in this world today. Yes. There is so much pressure on eating the right foods, having the right diet, having the right body type, that it is no wonder that people are constantly thinking about this, and it is a major source of stress.
Yes.
So I see
feel
that.
like on both, like the pendulum almost goes in extremes in either direction. You have people who literally like eat like crap and they are going to fast food places. That's really not the demographic that we see. Most of our clients feel pressure to eat clean. Like our clients that we treat are they think they're super healthy. They live in a culture of like good lifestyle, exercise, and there is a lot of pressure to sort of eat clean and eat like whole foods, but the truth is we don't know how some of those foods are showing up in our body.
Yeah. It feels like a never-ending list. Mm-hmm. Diet, check. Exercise, yes. Check.
Yes.
Make sure my foods are organic, check.
Yeah.
But yeah, and coming back to when I first started seeing clients with you, it was interesting because in my head I was thinking like, okay, I've done this before. I've worked with, these conditions for a while, the endometriosis, PCOS, chronic constipation, IBS, SIBO, whatever it is, and thinking I'm coming to the table with my diet instructions and definitely with my own spin on things. But for the most part, I felt like it was going to be pretty straightforward. And I don't know why I thought that, because 2 minutes into my first client at your office, and I felt the frustrations that these clients were experiencing. And I really just saw the pain.
Yeah.
And I saw the, embarrassing symptoms for sure, but there was just so much behind that. And there were so many clients who had been from doctor to doctor to doctor. Pretty much that is a common theme. Everyone has been to many doctors. They feel hopeless. They feel like no one really understands or is going to be able to help them.
Right. They feel so demoralized. And I feel like, this is like the thorn in my side of trying to figure out, well, I shouldn't put it that way, but like sort of on a mission, how do we undo that? Most of our clients have been, I think the average in general for people with persistent pain or chronic conditions is 7 to 10 doctors, right? Mm-hmm. The problem is that's a problem in and of itself. The problem is no one's communicating. Everyone's doing tests. Most of the time, the tests are normal, and the client still feels like crap. And everyone starts telling them that everything's okay, and perhaps the problem is with them, but no one's connected the dots. And that's also another reason why I thought it was so important to have you on board, is because we all know that food could be poison or it could be medicine, and we have to use it to help us in healing. And it was just another way for Pelvicore Rehab and our team to validate people that it's not in your head. We understand why you may be feeling the way that you do, and that there are so many amazing strategies that we can put into place to help you feel better. Sometimes it takes a while because they've been through so much. But I mean, I don't know how you feel, but I feel like a lot of our clients are ready. they're ready. They're afraid sometimes because they've made changes that sometimes they're convinced are best for them. And we need to open their mind of like, well, let's get curious. Let's try something different and see how that works for you.
Yes, you're right. They are ready. Every single client I've met with has been so ready for change and relief and like I said, someone to hear them out and really hear them and really spend that time with them.
Yeah, I actually got an email, and these are the best kind of emails, from a sweet client that we're both working with. And she just actually emailed me, "Wow, you responded to my email." That was her email to me. She's like, she said, "I really think I'm going to be able to turn the corner with this thing with the help of you and your team." But what astounded me the most about that, Megan, was that she was shocked that I responded to her email. Like literally wow in caps with an exclamation point. And we need to come at these people like love bombing them. Of course I responded to your email. You know, what you're going through is important to us, and we are not going to, let any stone be unturned until we find a way to help you.
Absolutely. This is fully a team approach. This is not us giving you instructions and sending you on your way. The amount of stories I've gotten from clients about, doctors just ran the test and then send me on my way, whether it's negative, positive.
Yeah.
A lot of clients do need some initial hand-holding, and that is not a bad thing. It's okay to need that.
Yes.
There's so much confusion out there, and it is scary. Like you said, it is.
Yeah. Well, and I think part of the dysfunction of the medical model is that I think people are going to doctors for that coaching, for that mentorship, for their guidance. And I'm not sure that the way medicine is now fosters that or facilitates that. I believe me, I'm not beating up on doctors. I feel like they are frustrated as well. I'm not criticizing anybody, but just speaking to people all day and being on both ends of talking to physicians and healthcare providers and clients, I can say that clients are going to their physicians because they're uncomfortable, because they're in pain, because they're having digestive issues. And we've been trained as a culture to go to doctors for that. So when people go to 7 to 10 doctors and they kind of feel dismissed or blown off, it can be depressing and anxiety provoking and stressful and frustrated. And then we come in and we sort of give them a family and hope, right?
Absolutely. Yes. It's so amazing that people keep persisting and keep going to doctors, but that is because of the amount of pain that they're in.
Yes. And I think that as humans, we're all different. We all have our unique purpose. We all have our unique missions. But we're all a lot more similar than we are different. We all want to feel good. We all want to have good quality of life. And the vast majority of people that I work with will not give up until they feel good, because we only have one life to live, right?
Absolutely.
Megan, how we deal with this quite often, especially with more complex clients where they have really narrowed their repertoire of food that they eat, and they really have narrowed down the diversity in their food choices. What's your approach to sort of dealing with these clients and, making them realize that, yes, we have to figure out what foods are best for you, but we don't want you to be afraid of food. We don't want you to be afraid of variability.
Yeah, this is such a good question and such a common concern that's coming up now. So whether it's been my history with eating disorders or digestion issues, or just regular people who are confused about what to eat, it is common to develop certain fears or anxieties around food. And in these clients, you're right, the options have become so limited. And so for everyone, it's going to be a little bit different. For some people, I like to share a lot of information on the gut and what we know is healthy for the gut in the long term, and that is variety.
I love that. That's brilliant.
So my goal for you is to be able to eat the widest variety of foods, plants, fruits, vegetables, whole grains, just everything. I want you to be able to eat all of the foods possible. And that includes some fun foods too.
Right.
And so in order to do this, I really like to ask a lot of questions in those initial first sessions. I like to get to know you. I'm very nosy, but I want to know.
Nosy is good in this situation, right?
Yes, yes.
We talk to people about things that I always say, what is spoken about at Pelvicore Rehab stays at Pelvicore Rehab, right? Because we really do need to know those details that most people don't share with other people.
Yeah, absolutely.
Yeah.
So I like to know, where did these fears come from? Where are your major triggers for anxious feelings? And what are you afraid of in terms of, what food is going to do? Is it that it's going to make your symptoms worse? Is it that you are afraid of gaining weight? Is it that, you're afraid of being unhealthy? Because oftentimes these fears really, they send us into what you mentioned earlier, that fight, flight, or freeze. For so many people, these fears cause us to freeze.
Mm-hmm. Absolutely.
And we cannot really incorporate nutrition into our life in a positive way when we have so much fear. So in order to feel truly empowered, which is what I want you, I want you to go into your fridge and be excited about everything that's in there. Be excited about pulling out those chia seeds or those strawberries. Yeah. And in order to get to that place, we have to fully go through your relationship with food. We have to work on connecting you to your body, and we have to really tease out all this excess noise and all of these shoulds and shouldn'ts. So sometimes the work we're doing is around your mindset. I do a lot of work around mindful eating behaviors, but there's a lot of mindfulness that goes into your thoughts around food, your thoughts around your body. If you feel like you can't trust your body, then there isn't going to be any trust there. There isn't going to be any connection. You're not going to be able to hear if your body's telling you it's hungry or it's full or these foods aren't working well for you.
Right.
So there is a lot that goes into it. It looks differently for everyone. Another example that comes up a lot, if you are experiencing a lot of bloat and digestive issues, it makes so much sense to me that you're not going to be able to communicate with your body well. And in order to do that, we might need to get you on a specific eating plan, maybe some structure around food, maybe some digestive enzymes or probiotics. We have a lot of different well-researched supplements that can be great aids for this kind of in-between area as we're getting you connected to your body again.
Absolutely. I almost think of, inflammation as almost like when we're talking about the digestive system is like static. It's like there's so much static in your gut, which I don't know why I perceive it as static, but your body's trying to communicate with you, and you just those signals are fuzzy. They're not giving you the right information. So one of our foundational components in what we do together as a team is help people eliminate inflammation. And also we have a very specific way to not only change people's relationship with food, but also we do have to figure out how certain foods show up in people's bodies, right? We are, first of all, we're bombarded with marketing all the time. Green juice companies, everybody now has to, knows about green juice and juicing or milk does a body good. Everybody knows that, but I say that in my presentations all the time, but milk can be good for some people, but is it good for everybody? So we do have to sort of figure out in a safe way, right? To keep the client feeling safe, how are things showing up in your body, right? I know we have so many clients who say, but I eat clean and I eat healthy and I don't eat anything processed, but we still have to figure out how certain foods are showing up in their body. And I think the challenging part is doing that in a way that clients feel safe and comfortable with. And that looks different for everybody. Right? That's why everything we do is individualized.
Mm-hmm. Absolutely. Yes. All the people are coming to me telling me, I follow a healthy diet. I eat these healthy foods, and they may not be healthy for you in this moment.
Correct.
And that's a big part of it too, is explaining that again, this is probably going to be temporary because my goal is to get you the biggest variety possible. Yeah. So while you may love eating sauerkraut and you may know that it is probiotic rich, it has all these benefits, if you have certain dysbiosis or gut infections going on, it could be making your symptoms worse. In that case, it is not healthy for you.
Yes.
And in order for true healing to take place so that we can introduce all the foods back into your diet, we may need some strategies of taking a pause on these foods, incorporating certain healing supplements or other healing foods. It's like you said, it's going to be different for everyone, but
absolutely,
that is very common.
It reminds me of how we approach exercise with people, right? What we tell people all the time is that there's no bad exercise. There are exercises that may need to be modified, and there are exercises that you may not be ready for right now at this time. And there are exercises that you may need a progression to go back to. And as you're talking, I'm like, it's really kind of the same way that we approach food. And for some reason, I think people can wrap their head around that a little easier with exercise and movement. And it's a little more of a novel idea to them when it comes to food, which leads me into the next segue that I always love talking about, because this is very personal for me. Everybody knows that I went to Weight Watchers when I was 9 years old, but I really believe that people do really well on diets. I think people do well on diets. I think diets fail people. I remember when I went to Weight Watchers, Megan, when I was 9 years old. I mean, I think Weight Watchers is very different now than it was back then, but they would literally give you a calendar, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and they would have a menu of what you needed to eat every single day. And reflecting back on that, I'm like, that's ridiculous. Like, what if I don't like those foods? Or what if those foods don't show up well in my body? Or what if those foods actually are limiting weight loss for me? It's so many diets are, and I don't think all diets are bad, but I think every diet needs to be individualized. They're so cookie cutter, right?
Absolutely. Like you said, if you're giving one diet to every single person, not everyone's going to like these foods. Not everyone's going to be excited about them. They're not going to make the time to go to the grocery store if they're not excited about them, or if they take too long to prepare, or maybe someone does have more time and they enjoy cooking, so they want that more detailed recipe. So everyone is so different. I find that cooking skills plays a very big role here.
Yes.
And then time management is huge.
I was about to say, and your ability to put time into food prepping, right?
Yes. And then, of course, preferences. So I talk about satisfaction a lot. If we aren't satisfied with the foods we're eating, it's not going to work.
Yeah, it's so true. It's so true. It's so funny talking about meal prep. I was in the office late last night, and Heather, who we both know and love, is my roommate, my co-tenant. And so it was about 6:30 at night, and I said, "Oh, please God, let my daughter have made me a salad and leave it on the table," because very often I get home from work and there's like a beautiful, delicious salad waiting for me. And I was like, "Please, please, please, everybody send Leora, my daughter, vibes to have a salad ready for me." And usually it wasn't last night, but I then had to push myself to make myself a healthy meal.
Yeah, and that is not easy. So that motivation piece, the experience piece, if you have no idea even where to start, you're more likely to just order out, pick up something on the way home. And another thing I want to add here is what else you've eaten or done throughout the day.
Yes.
Because if you get home and you're ravenous, or if you get home and you've already eaten out all day, then these are setting you up for your next meals.
Yes, it's so true. One of the reasons I always say everything that we've done at Pelvicore Rehab has been born out of seeing what our clients need, and food and nutrition was an integral part of it. It's now one of our pillars of health. I would love to chat for a few minutes about how we can use food as medicine, because we all know food could be medicine or it could be poison. So I would love to hear like tips and tricks. Like, what do you love in certain situations? And I think that it's also unique to the season of life that you're in. I think when you're pregnant, when you're postpartum, when you're perimenopausal, or you're, living in menopause for several years, your nutrition can look different if you're trying to get rid of inflammation, or if you're, dealing with infertility or PCOS. So give us some like golden nuggets that you like to share with clients.
Yeah. I think my favorite thing to talk about when we get to that nutrition piece is inflammation.
Yes.
So love talking about ways to incorporate anti-inflammatory rich foods. And these are going to be foods that are high in omega-3s. So a couple different ways we can get omega-3s in our diet. We can definitely do supplements like fish oil, algae oil. And for certain conditions, I do recommend that high dose, because it is just tough to get these foods in high doses into our diets.
Yes.
And you'll see why. So foods that are high in omega-3s, all types of fish, but specifically mackerel, sardines, salmon, a couple others, herring. So those are some big ones. And if you don't love fish, it's okay. We have a few other ways, but fish is probably the best one. Nuts and seeds. So chia seeds, hemp seeds, flax seeds, walnuts. Those are really easy ways. We can do edamame. There's also... what was the other one I was thinking of? If you like sushi, I know there's fish there, but seaweed.
Yes.
Seaweed that's wrapped around sushi is going to be high in omega-3. Definitely think about things from the ocean. And then another way to combat inflammation is through antioxidant-rich foods. So pretty much every fruit and vegetable, anything that has a bright color, reds, yellows, oranges, deep greens, those are all going to be really anti-inflammatory for you.
I love it. My son who just got married, him and his wife love berries. So every time they come over, we have like a big bowl of berries, like waiting on the table, and it's gone in 10 seconds. But like, just eating berries and, melons and things that they're so delicious. I call it God's candy. That's what I call it, because it's so delicious and so healthy. And also just even for women that have hormonal imbalances, to incorporate phytoestrogens in their diet. There are foods that we can eat that mimic estrogen and the power of herbs, right? Even rosemary and thyme and sage, all of those like herbs are so nutritious and can be anti-inflammatory and can act as phytoestrogens. But again, it needs guidance and mentorship, right?
Yes. Yes. Just Googling anti-inflammatory diet can send you down a rabbit hole where, again, you freeze, right? There's so much information coming in. So whenever I'm working with a client, we're typically setting some real specific and realistic goals, and whether that's incorporating a tablespoon of chia seeds with your breakfast each morning, whether you're getting salmon 3 times a week, whether you are adding in, walnuts as your afternoon snack, whatever it may be, we're going to find something that is tailored to you and your preferences, right?
Yes.
And also, what feels realistic to you. And if these foods are just not foods that you are okay eating, whether you don't like them, you have allergies, whatever it may be, there are other ways to do this. We can find the right supplements, but I'm sure we can find the right foods as well.
Yes, absolutely. And I think it's such a relief to people when they work with you, because it's something that we struggle with. A lot of us for the majority of our life. And I think part of the problem is that there is so much information out there, and so much of the information seems like it applies to us, but it doesn't. Like so many of our clients go on the low FODMAP diet, and it's so restrictive. And if you need the low FODMAP diet because you have SIBO, or, someone that is in the healthcare profession recommended it for a limited amount of time, okay, but so many of our clients go on it because they think it may help them, right? And I think just being on a super restrictive way of eating can, in and of itself, precipitate, disordered eating. Or so many of our clients think they're going on the IC diet, which is the interstitial cystitis diet, but there is no IC diet. There's no true IC diet. The true IC diet is meeting with people and talking to them and really figuring out what are their bladder irritants, how are certain things showing up in their body, and then cultivating a food plan that makes sense for them in their body. Or, people are in the ketogenic diet or veganism. They're all okay, but is it okay for you? Is it good for you? And I think so many of our clients have so many questions, and just having you as part of our team has been such a breath of fresh air for everybody.
Thank you. I think you're making some really excellent points. And it's so important for people to hear that, right? That just because you read about it and you think it might be worthwhile for you to try, it can lead down a rabbit hole of more and more restriction and more fear. And the best way to approach this is to get yourself a treatment team who really cares about you and who understands these different diets and if they should be temporary or how you should reintroduce foods back in once you're ready.
Right. I think one of the things that I love to say about what we do is that we would never ask our clients to do anything that we don't do ourselves. I think in some way, shape, or form, we've all been through, something where we had to really think about our health and get the self-care that we needed and really individualize how we eat or how we move. So I think it's as a team, we're so compassionate about and we have so much empathy because we've all had our own journey. So you need to find someone who's been through it themselves, but not only that, has helped so many other people. And that's why I think finding a team, finding mentorship, finding a coach is so important.
Yes. I know today isn't about me or my journey, but I've definitely been through my share of digestion issues, hormonal issues.
Yes.
My own diagnosis of PCOS really led me to just fall in love with these conditions and helping people because I know firsthand how confusing it is and how hopeless you can feel.
Yeah, and knowing that now that there is hope and there is a way out with the proper guidance and the proper help. So I think the most important thing is that your body wants to heal. Your body wants to heal. It has an innate intelligence to heal. We just have to listen to the cues that it's giving us and find the right path for it. And, that sometimes needs help. That's why we do what we do. Megan, I could talk to you all day about this, or maybe we'll have to do a part 2, but can you share just some takeaways that you want our clients to walk away with?
Yeah, definitely. So the first one is just if this is really resonating with you today, I want you to know that you're not alone. That if you are feeling anxious and if you're freezing because of all the information, you're not sure what to do, you're feeling just lost, you are not alone. And there are so many others who have been exactly where you are and they have found the right help. There is help out there for you.
Absolutely.
And the other thing I want you to know that if something else was resonating with you here, if you were feeling like, oh, maybe I do have a little bit of a disordered thought process around food and how foods feel in my body. Maybe there is some disconnection there. One of the best things you can do is just to start working on that relationship with food and maybe start noticing the shoulds, the shouldn'ts. Notice where these ideas and information around what you think you're supposed to do are coming from. And also give yourself a lot of compassion right now because positive behavior change doesn't come from shame. It comes from kindness.
Yes. My best friend Jackie she's also a PT and she was a nutrition coach for a while, and she had an amazing analogy and it made me think about it with shame. If you are on a road trip and you take a wrong turn, you're not going to continue going down that path and keep making wrong turns, right? You're going to take out your navigation system and you're going to get back on the right road and you're going to start getting on the right path so you could get to your destination. And I think there's so many of my clients are like, oh, I wasn't good this week, or I had a beer, or I had a glass of wine. And it's not about deprivation. We all make choices, and we need to give ourselves grace and compassion. And if we do go off the path, because we have temporarily made a decision that we're like, I don't want to do that again, or it was right at that moment, but moving forward, I realized that maybe I didn't feel so great after I made that choice, and you just get right back on the path that you have learned that is best for you.
Yes, absolutely.
So I gotta thank my BFF Jackie Kimmel for that. Megan, thank you for joining us today. Thank you for being such an important part of the Pelvicore team. I really can't imagine our team without you.
Well, thank you so much for saying that, and I'm just so happy to be here.
Thank you so much for joining us on this episode of your Pelvic Health Podcast, where we give you the real lowdown on all pelvic health matters. Please don't forget to like, follow, and subscribe. And don't forget to leave a 5-star review so we can continue bringing you the information that you want to hear. And always remember that healing requires a whole body approach, and that you need to be your own best advocate.